So how do you treat dogs with allergies?
If you're dealing with food allergy, obviously diet change.
So how do you treat dogs with allergies? What do you like to do?
So, yeah, I mean, I like to start small and then go big, depending on severity. So, a dog might come in with excessive tearing or sneezing, not much in the way of any no visible skin lesions. And for those, we'll get to the more heavy hitters, but I'll just tell owners about like over-the-counter stuff or home remedies. I know that one of those questions was like kind of stuff at home that you can do. Omega-3 fatty acids, fish oil supplement, that's a great one. I think the brand name, or one of the things that we have in our clinic, is called Snip Tips. So those are good options for dogs and cats who have itchiness, or it also helps kind of with the hair coat and kind of getting that nice sheen look. Those are good options. Over-the-counter antihistamines are something that I often tell owners about, and then they're like, "Oh wow, I didn't realize that I could give my dog Zyrtec or Claritin," and I'm like, "You can."
Yeah.
And so that's something that can be done.
What dose do you normally give them? Of like Zyrtec or something? What do you tell people?
It depends on like the size of the dog, but like 5 or 10 milligrams.
Okay.
Yeah.
So how else do you treat them? Sorry, go ahead.
Yeah. So, antihistamines. If you're dealing with food allergy, obviously diet change to a novel protein diet or hydrolyzed protein diet, and then doing that for 8 to 12 weeks, and then re-challenging with the original diet. And then if you get a bad response, skin breaks out, diarrhea, you immediately put them back on the new one, and that's what you feed them for the rest of their life. So those are ones that I think about for food allergy. And say you have a dog who's not responding to any of these changes, then you start broaching the topic of Apoquel or Cytopoint. And those are, for listeners who may or may not be familiar, it's a medication. Others like a monoclonal antibody injection. The injection being like once a month or once every 2 months. So it's not solving the problem. It's going to be treating the symptoms, and it really has a pretty high efficacy in treating pruritus. I found in my patients that it works really well and really no side effects, or it either works or it doesn't kind of thing. But it really targets like the cytokines and helps dogs feel better. So for dogs who have really just intractable itch, I will give them that. Whether I even have a diagnosis established or not, I think that it can be really beneficial for them. And it's something that you don't need to give orally, just a quick injection in the hospital. So I like that a lot. Apoquel is one of those things where it's more chronic usage, or it's given once. You start off like twice daily dosage and then once daily kind of after a 2-week period. You kind of do have to monitor blood work every couple months, maybe every 6 months, for like liver value elevations. But that's also kind of an option for owners to do like at home allergy pills.
My wife's dog is on that. Is on
cool.
Apoquel, and I laugh at her because she always, and I can only do this to her, but she called it Apoquel.
Oh.
And I'm like, no, it's Apoquel. She's like, no, it's Apoquel. I'm like, no. We have to laugh about that. It's a good time when she mispronounces veterinary stuff.
I honestly love when people come in and call things. Yeah, I love it because, so many things have multi-syllables, and it's just like, wow, if you're not a vet or you're not like in the industry, it's going to be really difficult. Like, I'm not expecting my mom to know this stuff, and it's just a lot of syllables. And so, like,
right.
Oh, one of them was like instead of trifexis, someone said triflexis, and it's like, oh, you get a new car. And stuff like that. But yeah, I mean, I say Apoquel, you say Apoquel, she says Apoquel. Whatever it is, it's definitely a good thing for our patients.
It's one of those things that once you hear somebody say it, you go, oh, right. Like, I do some medical narration, right. And when there's certain words that are, you're like, but, they're like, no, it's this. You go, oh, that's right. Yeah, I forgot it. Just, it's not a thermometer, it's a thermometer. So yeah, you just kind of have to go from there. So
one of my professors said apoptosis and not apoptosis, which we always thought was funny. Yeah, but those are things that can be done. And steroids, steroids are a beautiful drug class that can really target itch well. They also have their fair share of side effects that I always talk to owners about before prescribing. But definitely, prednisone or prednisolone for cats can be something very good for them. But yeah, I mean, it kind of depends on severity and previous history. Some owners, they're going to hear that their dog has these bad environmental allergies after ruling out other causes. They're going to be given a month-long course of Apoquel, and they take it home with them. The dog does great, and then you lose them to follow-up, and they take the dog off of it, and then soon thereafter she's going to be back itching. And so, like, it's one of those things where it's like, oh, I'm sorry, honey, you don't take your dog off of it. It's good that the past 3 days have been helpful, but you don't take it off because the dog's no longer symptomatic. Like, it's actually potentially going to be requiring this long-term or indefinitely, unless you move somewhere where whatever the offending allergen is not going to be a problem. But that's something that, you kind of have to stress to owners, because, I get it. Like, it can actually be very expensive to treat dogs with allergies, and not so rewarding when you don't even necessarily know what you're treating. If it is like atopic dermatitis, which oftentimes is most likely the case, and you don't actually know what it is because you don't, the owner doesn't want to do the tests, and I understand that. And so you're just trying to really keep the dog comfortable. And at the end of the day, like, I'm of that mindset too. Like, I want to do something that's best for my patient's quality of life, even if I don't exactly know what they have. So, that's what I do for them. I try to make them as comfortable as possible while reducing potential side effects and trying to figure out what's the best thing. Are we going to do the Apoquel indefinitely and Cytopoint every month, every 2 months, kind of depending on when a dog's itchiness may recur? And, those are very individualistic things. There's no one right way to tackle this, unfortunately. It's very patient specific.
Right. And there's so many different things they could be allergic to. You're almost like, let's try this and see if it works. And then if it works, you just kind of go with it. What percentage of people actually go through with the allergy testing, and what's involved in allergy testing?
Yeah, so I'm not sure what the statistics are, for everyone, but for me at least, like I've only, I think, had 7 patients who have done the HESCA allergy test that we, get a blood sample, send the serum to Colorado, laboratory in Colorado. 3 weeks later, they send back the results. That's kind of what's involved with that. And then the other far less chosen route would be, if I refer a dog to a dermatologist, he or she will do the, intradermal skin test and potentially do like allergen specific immunotherapy, which could be shots or like oral, lingual medication. But a very, very small percentage owners end up going down that route.
Is there any way they can prevent allergies?
I don't really know.
I mean, a lot of times you don't know you have them until you start having them. So
yeah, I mean, avoid, keep your dog locked up in a vault 24/7, and don't feed him or her anything because that food could potentially be an allergen. So don't feed it anything, don't give it anything, don't look at it, keep it. No, I'm just kidding. For those listening, this is not medical
hermetically
advice.
Sealed room. Yeah, that's right. Yeah.
No, I mean, it's, we can't all live in a bubble, but I'm not necessarily sure. We can prevent, symptoms, or not necessarily prevent, but reduce likelihood if, we have diagnosed history of it and known response, positive response to, various medications or, some of those home remedies. But yeah, I mean, it's one of those things that, if you have it, you can't really get rid of it necessarily.
So this is not something you necessarily cure. You just kind of have to live with it.
Yep. Avoid it, live with it, reduce symptoms of it. There was a vet, so this is a human with an allergy, but a vet, I think she was a resident when I was rotating student. She had, I think she was allergic to cats. And I just know that she took shots every day to do her job as a vet. And I'm like, wow, that really is incredible. I don't know if I could do that to myself.
No, but it's like being diabetic. You give yourself insulin shot.
I mean, but she didn't have to choose a profession that required to be around cats every day. But
that's true.
Yeah, but yeah, no, for sure. I'm that's
exactly so. I will let people know they can go to rockwellpetspro.com and use the, oh no, my thing went away. Use the code. I had the sheet and I lost it.
The code.
I believe the code is allergy. I believe they could get some of the bone broth with turmeric, $10 off that at rockwellpetspro.com. My page cut that off. Is there any other things you want to talk about with allergies? Any other tips and tricks you want to give people? Just be on the lookout for. I mean, you got the Benadryl you can give from the store. Go see your vet, obviously. But
yeah, I mean, definitely, I recommend go see your vet and just and an appreciation. Some I acknowledge that a dog itching him or herself doesn't mean that he or she has allergies. It could be like a focal scratch. Maybe they rubbed up against something and were laying down. They just have an itch. It doesn't mean they have allergies. But what I would be strongly recommending to owners who I'm sure, love their dogs and want what's best for them. I see owners walking down the street, their dogs who are kind of limping behind, and they don't notice their dog's back leg is limping, for whatever reason, it's patellar luxation or maybe a cruciate ligaments pulling, or who knows, but they're kind of pulling the dog. They just aren't aware of it. And I see that and my heart breaks. So I guess my final bit of advice would be like, if you're suspicious that your dog might have allergies or has been scratching a lot at his ears or really any part of his body more than what's considered normal, or you see redness or you see really anything that's out of the normal, benefit of the doubt, give it to your dog and give them the gift of, going to see the vet, because, it's painful, and it's, being itchy is not a good feeling. That's what I would like to leave my note on.
Okay, so I got my sheet back here. So natural dog bone broth with turmeric. I was right. Get $10 off with the code Allergy, and not Allergies, but Allergy at rockwellpetspro.com. Well, it's been an interesting show with the internet issues. I'm gonna be on the phone with my internet company tomorrow, trying to get this thing worked out. So Comcast.
Good luck with everything, right?
But we'll be back next week, same time, 7 p.m. Thursday night, live here online with Rockwell Pets Pro and Dr. Max and Ask Our Vet. Dr. Max, you have a great week, and we will see you next week.
All right, you take care. Bye-bye.
Hey, if you like this video, don't forget to like and subscribe to the channel and share it with all your animal-loving friends. My name is Mike the Voice Monkey, and we will see you this week with Dr. Max on Ask Our Vet.